definitely to support you guys. We know that you support us and our jobs every single day in the hospital, and we think it's unconscionable that they're trying to take away your health care when you work in the healthcare industry. No takeaways.
But he asked me to come here today to support you, and he's very much hoping to see a resolution on this contract and without any takeaways, and especially hoping that CPMC does the right thing as a healthcare provider and make sure you have the best healthcare benefits in the country.
I'm very happy to be here and stand with the workers as part of our theme throughout the whole last election campaign was keeping San Francisco affordable for those of us who live here.
You know, there's an affordability crisis. We all know this. The people that are most affected are the people that are trying to increase the out-of-pocket costs for healthcare, and is echoing everybody else's concerns. This is absolutely unacceptable.
The main issue is our health insurance. You know, we've been having, we never had problems before in the past. All of a sudden, Sutter took over, they want us to pay for insurance. And this is for the family, you know, the future. We don't know what's going to happen.
They want to triple co-pays to office visits.
It's a big takeaway for us, so now we have to pay $1,000. People who have family or people who are more sick or getting old.
We want anyone choosing the PPO to pay much higher premiums, as much as $600 a month for a family, which with the wage scales that we all work at would be impossible.
We work for a hospital. I can't believe that we have to fight for this, because if it wasn't for the workers, the hospital wouldn't be what it is today.
We work for a hospital. We work for a company that is providing help for the people. Why they want to make to the employer so hard to have a health plan.
Today we're going to have a bargaining meeting. We're going to meet with Sutter. We're going to talk about all the issues we're having and all the cuts. Health insurance, that's number one.
Welcome. Hi.
Yep. Hi.
My name is Juliana Milanesa. I'm with Coleman Advocates for Youth and Jobs and Justice. And I'm here representing many community organizations that are supporting the workers here. The question is, if you cut their health care, they already are having a hard time living in San Francisco. And it's inhuman and it's cruel. Health care is a human right. For you to cut it means that a lot of them will be have lower income, be forced out of the city, as so many of our working people have.
We passed a resolution actually in support of the workers. We're extremely concerned about the workers that we really feel like are being targeted with that.
It really urges you to settle a fair contract with these workers, and actually finds it appalling and embarrassing that one of San Francisco's leading healthcare providers is proposing to take away healthcare benefits to these workers. It's outrageous.
And I think it's unconscionable to request that they have takeaways to their health care when what they do is take care of other people.
We know what Sutter is making. We know that you're extremely profitable, and the ACA is a boon for you. You can afford to pay them a living wage. You can afford to cover their health care.
Okay, we want you to take the time to read this. It says, don't encourage further displacement in San Francisco. It's on you, okay?
All right.
I think most people, 80% I can say, or 90% is ready to go out and fight. It's going to affect because we're going to lose money, you know, during the strike. But at the end, we're going to win.
Viva!